is Jamie Preston, and today I will be talking about the current health issue of anorexia nervosa. Anorexia nervosa is an eating disorder that comes from an unstable mindset that creates an intense fear of weight gain. This fear of weight gain leads to restrictive eating to the point of self-starvation and a distorted perception of one's body weight. Patients with anorexia perceive themselves larger than they really are. They are never satisfied with their size or weight. However, anorexia is rarely just about food. Instead, it's an unhealthy way to try and cope with emotional problems. The causes of anorexia nervosa are biological, psychological, and environmental. Biological. The genetic makeup of some people are more vulnerable to developing this disease because some genetics make people have more of a tendency toward perfectionism, sensitivity, and perseverance, which are all traits of anorexia. Psychological causes include depression, obsessive compulsive disorder, and equating your self-worth to your thinness. The psychological starts to take over your mind, causing you to become depressed because of the size that you are. It creates this obsessive compulsive disorder to just obsess over how small you are and how small you need to be. The environmental causes are your gender and age. Being a female in adolescence has more of a tendency to make you become anorexia nervosa because females are looked at on more of their appearance. And so therefore, females have more of a tendency to want to be a certain size. And also with age, peer pressure is high at young ages, adolescence. And therefore, peer pressure of being a certain size that is shown on billboards and magazines and movies is important to these young girls. Also, sports is a major cause of anorexia nervosa. Many people would think at first that it's the female sports, such as modeling, dancing, figure skating, cheerleading. However, it is male sports as well, such as wrestling, swimming, soccer. All of these sports require you to be a certain size and weight. For example, wrestling, you have to be a certain size to meet your weight requirement for your meet that day. So, I understand being an athlete myself that some sports require you to be a certain weight. However, coaches should be aware of this disease and make sure that the weight loss is done in a healthy way. And also, like mentioned before, society and media have a huge impact on anorexia nervosa because people want to be what they see on TV. And if all they see on TV and in fashion shows and on billboards is these stick thin 100-pound girls, that is what people are going to want to be. So, symptoms of anorexia nervosa can be physical as well as emotional. The physical symptoms of anorexia nervosa are some of the obvious, such as a thin appearance, extreme weight loss. However, there are more, such as abnormal fatigue, dizziness, fainting, hair thinning, insomnia, and intolerance of cold. These are all physical symptoms of anorexia nervosa. Your body starts to lack the nutrients that it needs, and it physically starts to shut down and cause problems. And emotional symptoms of anorexia nervosa are refusal to eat, denial of hunger, fear of gaining weight, lying or being secretive about food, social withdrawal, and depression. These are the emotional sides of the symptoms that start to happen whenever you have anorexia nervosa. Because, once again, your body needs these nutrients and it starts to shut down the hormones and emotions that you have. Once these symptoms have gone on for so long, long-term effects start to take place because when the body lacks the nutrients that it needs to function, these long-term effects start to take place and cause the body to function incorrectly. These long-term effects can include impaired immune system, anemia, decreased blood count, brain and central nervous system impacted, the absence of a period or decreased testosterone, bone loss, heart problems, and worse, death or suicide. 1 in 5 anorexia deaths are due to suicide. These are all long-term effects that start to happen because the body just shuts down because it does not have the food and nutrients that it needs. This is especially dangerous for adolescents because their body is still growing and going through puberty. And to do these things, it needs the nutrients to develop properly. And therefore, if they lack the nutrients that they need, their body will start to stunt their growth and not go through puberty. So treatment and recovery. Treatment is definitely hard for anorexia nervosa patients. However, it is always possible for every patient. There's many treatment options depending on the need of the patient. Treatment generally consists of both medical and psychological treatment. Medical treatment includes addressing the health-related problems that has occurred. The psychological treatment will address the mental state that the patient is in. There are 2 types of therapies: family-based therapy, which is leaned more towards the teens, whose families will be involved in their recovery process. It is important for the family to be there during the therapy session to understand and know the next step that their patient needs to go through to help recover and get to a healthy weight again. And cognitive behavioral therapy is a therapy that treats emotional problems and increases happiness by modifying dysfunctional emotions, behaviors, and thoughts. This type of therapy helps the mental state of the patient. It helps them to get back in a happy state of mind so that they don't equate their self-worth with their thinness. And another treatment option is meal plans. It is important for a patient to have a meal plan because they need to be able to see what they need to eat each day, when, and of how much. They need a certain amount that they have to eat so that they can stay on track. It is also important for the family and friends to be aware of this meal plan so that they can help the patient be aware of this and keep them on track as well. However, it is good to start at a low calorie intake to work the patient as well as the body's organs up to normal eating habits again. You do not want to give the patient a high calorie intake at first because the body as well as the patient will be overwhelmed by too much food intake. And also, hospitalization may be necessary. If the patient is so severe that they need intensive care, hospitalization may be necessary at first. Also, there is no medication specifically for anorexia nervosa. However, studies have shown that antidepressants have been able to help with the psychological side of this condition. Like I said before, anorexia nervosa is difficult to treat, but nearly half of all sufferers can fully recover if patients follow their meal plans, visit their therapists, spend time with family and friends, and resist weighing themselves. So just a few facts about anorexia nervosa is at least 30 million people of all ages and genders have suffered from an eating disorder in the U.S. Eating disorders have the highest mortality rate of any mental illness. And a total of 1.2 of the population 15 and older have had anorexia at some point in their life. And lastly, 50 to 80% of the risk for anorexia is genetic because, like stated before, it is a mental illness and some genetic makeup just has more of a tendency to cause these people to develop anorexia nervosa. So thank you. I hope now you're more aware of the health condition of anorexia nervosa and can prevent many people from developing this disease. So next time you see a stick-thin figure out on social media, on a movie, remind your friends that they're beautiful no matter the size that they are. Thank you.